Hi, everyone, and welcome to the Muslim Sex Podcast. Thank you so much for tuning in. I really appreciate your patronage, and I would love it if you could leave me a 5-star review because that really helps me. And if you could like and share this episode with somebody that you know that may benefit, your friend, your colleague, anyone, I'd really love you to share this podcast, especially if you find value in the Muslim Sex Podcast. Also, I'd love for you to subscribe to my YouTube channel and follow me on all my social media. Also, as you probably know, if you've been listening to this podcast, is that I have a practice that is now open in Chappaqua, New York. I see patients for menopause and sexual health, as well as regular gynecology. So if you are looking for a gynecologist that actually spends time with you, that has time to listen to you, then I would invite you to come and see me in my practice, and I'd be more than happy to take care of you. So make sure if you live in the New York area, or even if you don't, come and see me in my office. I'd love to meet you. And also, last but not least, is that I am hosting again my retreat in Morocco for 2025. So if you are looking for a gift for a family member, a friend, yourself, make sure you take a look at our retreat, the Love and Nourish Retreat. It will be held September 19th through the 26th, 2025. Again, this year in Morocco, we will be visiting the same towns. We will be in Marrakesh and Essaouira. And as always, we will be providing information and lectures on menopause, perimenopause, nutrition, and also going for cooking classes as well as excursions. So don't miss out. I know a lot of people were sad when they missed out this past year on the Morocco retreat. So make sure that you go and visit the Love and Nourish Retreat hosted by Caria Retreats. And now onto the episode. I am an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodi, and this episode is everything you need to know about what is going on in the European Union in regard to sexual medicine. And I have such an amazing guest on with me today. But before we get into it, the first thing I want to make very clear is we are not giving any type of medical advice. So if you have any questions about sexual health, please make sure you go and see your healthcare provider. And if you have any questions about your religion, make sure you go and speak with your friendly neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So I am so excited to have on with me today Dr. Emmanuele Jannini. Dr. Emmanuele Jannini comes to us all the way from Italy. He is in Rome right now. So excited to have you on, Dr. Jannini. Welcome.
Thank you so much. It's my great pleasure to be here and to discuss and to learn from this unique Muslim sex podcast. A really very interesting experience. Thank you for inviting me.
Oh, yes. Thank you. So, I'd love for you to introduce yourself to the viewers and the people listening to the podcast that may not know who you are. I'd love to hear from you a little bit about yourself, and then I can tell you what I found out about you on Google.
Just to shortly introduce myself, I have to say that I felt in love with sexual medicine, and in particular with the education in sexual medicine, which is my major task, along with researching and searching. So the motto of my chair, because I'm a full professor of sexual medicine in the University of Rome, Tor Vergata, the motto is teaching and searching pleasure, because the idea is that we really need to provide more not so well understood, not so well studied field, which is that one of the pleasure, which is tremendously important for the human sexual experience. So that's the reason why I'm so proud to have this wonderful group of young people working with me and helping me in making research basically in, let's say, three major fields. One is the traditional research field, which is male sexual dysfunction. The other one is much more exciting, I have to say, because it is much more new. It is about female sexual dysfunctions, and I really enjoyed to work with at the different levels in trying to understand scientifically the female sexual physiology and the major problems which may occur in the female sexuality. And the third, which is last but not least, is a kind of cultural approach to sexuality. This is because of some studies I did in my past regarding philosophy and theology. And I think that those are quite interesting experiences that I'm now doing mostly in Orient, in particular in China and Vietnam, and meeting those completely different way of thinking about sexuality, about the way people believe is the right sexuality, I think is another very exciting experience. Don't be afraid about the noises which are coming from my house because I have a number of of watches. So
No, that's fantastic. Well, that is amazing, all the work and research you're doing, and really, truly global, which is fantastic. So, when I was looking you up, it says here that you are a professor of medical sexology at the University of La Aquila and full professor of endocrinology and medical sexology, and that you did research. You co authored a paper in 2010 on who's afraid of the G spot. That's amazing. And it was a review by 6 scientists from several countries. I'd love to hear more about that. What did you find out about that? And then you also do couples health and your studies in male and female sexual and reproductive fields. I mean, you are truly an amazing person. I'm so grateful to have you on. So I'd love to hear more about your paper that you published back in 2010 about the G spot.
yeah, you are tremendously kind, let me tell you. So invite me more frequently
Yeah.
because I like very much to meet, unfortunately, just online. What about the G spot? Yes, that was something which was coming from an initial experience studying cadavers, and in particular going into the region in the public known as the G spot, which is more technically the anterior vaginal wall, where it has been considered a particular region for sexual pleasure, for delivering the pleasure coming from the vaginal penetration. So the argument was a matter of a huge discussion and not always scientific, sometimes more ideological in nature with respect to the scientific one. So our first experience was definitely biochemical and anatomical, demonstrating that yes, it is true. In the anterior vaginal wall do exist several structures, which are the vagina itself, which are the urethra, which are the glands surrounding the urethra, and of course the inner clitoris, which is the part of the clitoris which is exactly surrounding the urethra. Maybe I have here, yes, a little representation of what I'm telling
That's
you, which
fantastic.
is that
Yes.
one.
Mhm.
So basically, we concentrated on this part of the story
Mhm.
because we believe that this part can be stimulated during the marital penetration. And this part, in the past called G spot, in fact, is delivering the kind of pleasure which is referred as different from that obtained from the clitoris, which is the normal
Mhm.
way, the most usual, the most frequent way to have a female pleasure. So basically, we decided to trust the women, the patients, the girls who are telling, okay, I am having a pleasurable experience, maybe in an orgasm, not just or only by the stimulation of the clitoris, but also by the penetration, by the marital intercourse, and so on. And so we started with, as I said, with the cadavers, and we demonstrated that there are some concrete actors of the play of the female pleasure in this region. But we also realized that studying cadavers is just the beginning. So we decided 10 years later to go into a more advanced way to demonstrate that this region is really important for the physiology of human female pleasure. So we use echography, we use echoscan in order to demonstrate into the alive person if this G spot, let's call it, into the wrong way just for a while, if this G spot is really different from that one of people not claiming the ability to get an orgasm from this part of the human body, and we succeed on it. And we
Mm.
published in the journal Sex and Medicine an article which was comparing the distance between the urethra and the vagina. So the distance, which is apparently significantly bigger in the subjects having the vaginal orgasm with respect to that one of the subjects having just the clitoral one.
Mm.
So this significant difference has been then confirmed by several other articles around the world from independent laboratories. So we can say that definitely the anatomy may help subjects to experience the pleasure from the anterior vaginal wall. The final problem was to make a name for it, to produce a name, because the term G spot, which has been coined by Beverly Whipple, a very good friend of mine. She was great in delivering science in the field of sexual medicine. However, the book she wrote, which was a kind of tribute to Grafenberg, Dr. Grafenberg, the first gynecologist who in the 50s described the anterior vaginal wall as a very important part of the female pleasure. The, let's say, I cannot say exactly mistake, but what was a little bit reason for misunderstanding was the term that she used, spot. So I can say that the spot as a spot does not exist in the human body. So we do not have, we did not discover, we do not have any magic button that you can press in order to have a magic orgasm or something like that. But we do have several anatomical and functional structures which are strongly modified during the stimulation. So, in other words, with huge differences between a subject to another subject into the same subject, according to the hormonal status, for example, menopause, non-menopause, middle cycle, luteal phase. So all differences are really impacting very much on the anatomy, changing the relationship between the clitoris, between the urethra, between the glands, between the vagina itself. All those things are changing dynamically and also changing according to the kind of stimulation received. So we wrote another article in maybe the most important journal in the field, which is Nature Review Urology, which was an article trying to create a new name, which is a more technical, not subject friendly, not people friendly, but that was the aim, to make something more scientific. And we name it CUVE, where CUV is a clitoro-urethro-vaginal complex, CUV complex. And the idea is exactly that one, to explain that that one is a kind of unit working into a so different way from girl to girl, from woman to woman. So the message is discover yourself, because the difference could be really, really important according to our studies. And the aim was to try to end the never-ending discussion about the G spot. It does exist, it does not exist, because this was not really scientific. So we
Right.
found something there. We found something which can be modified due to the stimulation. We have been able also to do something absolutely new, to make the ecography, to make our examination during the intercourse, using two French volunteers in Paris, together with gynecologist Odile Buisson in Paris. We have been able to really see what's happened into the female genitalia during the penile stimulation, during the intercourse, and that was the really first time that such an instrument, very stupid, very easy, very common instrument, has been used in order to demonstrate which are the real anatomical changes during the intercourse, in order to stop too many words and to look at the evidences.
That's amazing. So I see that you named it the clitoral urethral vaginal complex, right?
Yeah,
Is it the
yeah.
complex? Yes. So that would be similar to now what they're referring to as the G zone as well, right? So we don't call it the G spot, but it's similar. I would assume that it's the same complex, the same network
It is
that plays
indeed.
into it.
It depends. If you wanted to honor Grafenberg, you can use a G. If you wanted to highlight the anatomical structures which
Yeah.
are involved in this part of the body, you can use Cuve. But
Yeah.
the most important message is you got it. The most important message is to avoid to use a spot, because people understand, well, I should have this spot, and if I'm not having this spot, I am a B woman. I'm not the right one.
That's right.
I must look for something which I have to tell it does not exist.
Yeah.
So that's the reason why we try to change the name.
I actually like your name much better. The reason why is that it seems like a lot of female anatomical parts have names of male researchers, right?
That's
Like
true.
fallopian, this G spot. I mean, there's so many things that are named, the speculum, the Sims speculum, right? All of these things are named after male, whether it's physicians or scientists. And I think it's time that women start reclaiming their bodies. So I like your term much better. And because it's anatomically correct. And like you said, it's not one spot. And you're absolutely right. When women are not able to orgasm, then they think there's something wrong with them, that they're broken, and that, they must not have this spot, right? Or that people are looking for this elusive spot and they can't find it. And it's not really a spot. So I think I appreciate your work and the research that you've put into it. I'd love to know more about the fellowship and the extra studies you created, the clinical psychosexology master's degree. I'd love to hear a little bit more about that. And are you really in China? It said you are a visiting professor at the Chinese universities in Shanghai. So do you also go to China?
Yeah, I do. I do very frequently, actually, and we have a very good relationship with several Chinese universities. We also created a scientific network which is called MAPS Gosh, Marco Polo, the name of the famous Italian voyager who arrived first from the Western countries in China for the first time. And it's called Marco Polo Study Group on Sexual Health. It is a network of several universities in mainland China, but also in Taiwan as well in Vietnam. And the purpose is to study together human sexuality, actually. And so it is really enjoyable because not only I am a visiting professor or honorary professor in those universities, but also I have several nice students in my PhD course in Rome from China and from Vietnam. And I'm really enjoying to meet the cultural differences and the way they are dealing with research in sexuality. So, thank you for the question regarding my new initiative of the Master in Sexual Medicine and Psychosexology. I think it is the first attempt in the world to put together into 2 years study, because it is quite a long journey, both sexual medicine and the psychosexology. The idea is that a doctor who wanted to deal with a human sexuality without knowing what are the major psychotherapeutical approaches, psychodynamics approaches, psychometric diagnosis, she is completely unable to deal with the sexuality. At the same time, I do think that a psychologist, even well trained, if she is unable to understand what the doctor is doing, which are the major tools the doctor is having in order to study sexuality, and the reason why is she is using surgery sometimes or drugs sometimes and so on. Again, she is not a good psychosexologist. So I don't want to transform in these 2 years a psychologist in the doctor, nor a doctor into a psychologist, a medical doctor into a psychologist. But I really believe that sexual medicine is a typical bridge discipline where you must jump from one culture to another culture. Otherwise, you will not understand anything about human sexuality. And in particular, I think that we will have several discussion about the impact of religion, the impact of philosophies, the impact of the cultures into the sexual health, into the way to understand the sexuality, into the treatments, which may be completely different. Another novelty is the fact that this course, which is not just for the Italian students, because we do have very good master courses in sexual medicine or in psychosexology in Italy, as well in Europe. So this one is the unique one, having both culture, but the target is outside Italy, maybe also outside Europe, because it is completely in English and completely online. And this is another novelty. So we will make a huge effort in order to have it using the best techniques to make it online, so that the students can really enjoy and to grow up into learning sexual medicine and psychosexology at the best. And I'm going to invite a lot of people discussing and recording their own lessons. And I will also surely invite you also to tell something to my future students about the Muslim sex podcast and your experience, because I think it is very, very interesting. So stay tuned with the Tor Vergata University website. I think that we'll announce the master in the next couple of months. And so I hope that people can be really interested in this new educational perspective.
I think this is phenomenal. I mean, I haven't heard of anyone doing anything like this, clinical psychosexology. I mean, that's so, it just makes sense, right? Because you can't do anything in sexual medicine without realizing that, I mean, we all know that the brain is the biggest sexual organ, right? So you really have to understand psychology. You have to understand where a person is coming from. You have to understand the thoughts that are going through their head, especially if they're trying to make a difference, if they're trying to change how they feel about themselves, about their body image, or, about things that are, I know you write a lot about premature ejaculation and erectile dysfunction. I mean, that's the psychological component of that is so huge, right? So I don't think that you can do very many things in sexology, sexual medicine, without incorporating the psychological aspect of whatever dysfunction that individual is trying to work through, right?
Yeah, you are absolutely right. I was really lucky because in my life I spent 25 years in teaching into the psychology faculty. I am a medical doctor, I'm an endocrinologist. However, we have a joke in Italy that the professor is who is teaching something that he doesn't know. So that's is a little joke because I'm not a psychologist, but I have between my fellows, my students, so many psychologists, and I really like very much to learn from that also. And also, I'm a medical doctor. I'm also a professor into the faculty of the medical faculty. So I think that this is the reason why I decided to have together these two different perspectives, which are apparently far, but in the case of sexuality, must be considered as a unit. And we call it this unit system sexology, which is the way to understand the sexuality using the system of the mind, the system of the experience, the system of the environment, and the system of the body. So only if the table is having these four legs, the table is stable. And that table is sexuality, is sexual medicine and psychosexology, is what we call the system sexologist. So four tables, which is a kind of integration or amelioration of the famous biopsychosocial model, which I like very, very much. I think that there was a kind of revolution to connect the body and the mind. However, to be honest, looking at my colleagues, it seems that okay, they claim that they want to follow the biopsychosocial model, but usually the major discussion is between the psycho and the body. While the social one, the cultural one, is not so much studied, is not so much present. So it's in the reality, the biopsychosocial model, which is again and again a very, very important way, method, or instrument or tool to study human sexuality, it is indeed good, but unfortunately understood by both doctors and the psychologists into a Manichaean way. Manichaean means black and white, mind or body, brain or penis or vagina, into a not really mixed way. So that's the reason I am proposing the system sexology, adding an emphasis, a particular attention to the cultural aspect, to the political aspects. Let me make a representation of it, very, very easy. I think that many of the people who is listening this wonderful podcast, they know very well what is a plastic bottle, because we are using a lot of plastic bottles for drinking water. Okay, so this is a political and economical choice, because in many, many places of the world it's difficult to have drinkable water into a different way, because it's very diffuse, it's cheap, but it contains the plastic, which is into the bottle, contains, we know very well, microplastics as well endocrine disruptors. The endocrine disruptors have been found into the brain of newborns, of human newborns, and a lot of evidences are showing that they are affecting both reproductive and sexual physiology. So, from the bottle of plastic to the sexual dysfunction, the journey is not too long. is quite close journey, actually. The connection is very, very close. In other words, I think that the system sexology is a way to understand how also the political economical choices are tremendously impacting into the sexual life of the individuals as well, of course, of the reproductive life. But so it is a kind of integration of the biopsychosocial model, and I think that the proposal of my master is exactly trying to go in this direction.
Amazing. Yeah, I love it. I'd love to, I don't know how much you want to get into the endocrine disruptors and how they affect sexuality, but I'd love to hear a little bit more about your thoughts and how that's affecting reproductive health.
Yes, well, really a lot of evidences which are connecting. So the endocrine disruptor, to be very easy and very simple, is a kind of fake key which is going into the tissues, telling to the tissues, look, I am an estrogen, which is not true, was a fake estrogen, and the tissue believe that the estrogen is coming there and may be transformed into a wrongly estrogenized way, where the tissue is suffering. We know, for example, that plenty of cancers may be produced by these endocrine disruptors, in particular mamma's cancer and the female genital cancers also. Reduction of fertility, of the ability to produce a good spermatozoa in a man, and also the size of the genitals could be also affected by, in particular the size of the penis, more likely also the size of the clitoris, which is absolutely not a studied issue, and it is quite
Right.
ridiculous that is not studied. This is one of the programs that we are currently following in our research. And so, again, plastic, bottle plastic, endocrine disruptors, and transformation into the tissues, which can go, in the worst case, to the cancer, into, let's say, the best case, which is not so good, in modifying our reproductive strength and our sexual strength too. There are plenty of evidences, for example, in Europe, demonstrating that the number of spermatozoa, it is about half in just 70 years. According to the farthest scientific demonstration of the number of human spermatozoa in Europe, we in the 50, the average number of the spermatozoa is about twice with respect of now, and the major reason of it is definitely pollution, and in particular this kind of pollution. But pollution is not something which is coming from the sky. Pollution is something which is about our choices,
Yeah.
our political choices, our economical choices. So this is just a very simplified demonstration of how thinking about the macro system, not just the micro system like the individual or maybe the couple, which is definitely a very important issue. It is a wonderful perspective, but we have also to go into something a little bit bigger, like the society, like the economy, like the policy, because all those things are tremendously affecting the people's sexual life. And of course, when we are mentioning policy, we should also think about the fact that some governments are doing well, some governments are not doing well with regard to the people's sexual health. And this is the system sexology, in fact. So the perspective, trying to connect all those things, to connect all the dots in order to produce a new figure, a new scientific figure of what really sexual health is and how to handle sexual health, how to help people with when they do have a sexual dysfunction.
I love that. I think that the people that reside outside of the US, I feel like they have a more global understanding and they look at things more globally. I feel perhaps in the West here, in the US, we have more of like an ethnocentric view, right? We don't really think globally. We have a lot of politics going on right now in so many different areas that I won't get into. But yeah, definitely reproductive justice is a big one, right? Here in the US, people banning abortion and not allowing, people come in with ectopics and then they're allowing those women to die because they're saying there's a heartbeat. I mean, it's just crazy. That's what happens when people that are not in the medical profession are creating policies and laws, right? People that do not understand what exactly is going on. So, but I appreciate the fact that people in Europe and people like yourself think more globally and how, our choices affect future generations and how we are impacting the reproductive health of generations to come without even realizing it just by simply using, say, like a plastic bottle that's going to go into the water system and all of those things. So I think that's really important. I'd love for you to talk a little bit just about the question of hormones. I think you lead a column on that, right, within the Super Quark program broadcast. Is that a column that you write, or is that a lecture that you give?
Ah, yes, that's true. That was in television, in the most diffuse and famous and popular scientific program in the Italian broadcast, Italian television. The title was Issue of Hormones, of Questions of Hormones. It is because I told you that I am an endocrinologist, so I'm starting from the hormones. But basically, that was the unique possibility to learn sexual medicine and psychosexology from the Italian television, actually, because
Oh, wow.
it was not so much diffused. And now the program is having another name, and I can announce that for this year we are preparing another broadcast, which is more related to the history of sexuality and how the different, again, cultures, different historical times are modifying the male-female relationship, the sexuality, and as well as sexual health. So it is a new format. So I will dress another habit, that one of the history habit, actually trying to demonstrate how the again and the knowledge of in that case of the history is tremendously helpful to understand why we are doing something good and why we are still doing something wrong into the male-female relationship, as well in handling sexual issues related to orientation, to the gender, and so on. So it's something which is coming from the history too.
Oh, that's fantastic. I wish we had something like that. Is that on is that on regular TV? Is that like cable network? Is that
Is it the
Netflix
regular
or
TV?
Hulu?
It's a public TV, yes.
Oh, that's fantastic. That's amazing. And, so if there was, you've published so many papers, you've published on the International Journal of Impotence Research, and you published some research on premature ejaculation and sexual dysfunction. So your focus is on both female and male sexual health. Do you feel that it's a predominantly, is it mostly male, or do you focus
Uh,
on both genders?
Very good question. By background, by education, I born as a neurologist, so my first scientific interest was definitely in the male. And when I was in United States working at NIH in Bethesda, I was working into the effect of thyroid hormones in the animal and human testes. So I was more focused at the beginning on male. But to be honest, between us, because we are you and me here, not too many, apparently, but of course I'm joking. To be honest, I found the male physiology a little bit boring.
It is
And
boring.
yes. So I said to myself, I have to expand my field of interest of research. And I realized that definitely going into the other side of the moon and trying to understand a little bit more is more fun because, to be honest, there is much more to learn, much more to study with respect to the male. For example, Viagra has been established many years ago, and we do not have at the moment a similar drug or a similar approach for female. It
Yeah.
means that for the researcher, it's much more interesting to go into, let's say, to boldly go where no one has gone before.
That's right.
And
That's
that one
right.
is the female sexuality, actually.
That's right. That's right. Yeah.
And that's what
There's
I'm
no
trying to do.
Yeah, there's not that much research on women's health, right? And women's sexuality, really anything about women. We don't really have too much. They will say that there are some that say that, flibanserin, right? But flibanserin acts differently than Viagra. And flibanserin acts increasing the dopamine in the brain, right? Increasing the neurotransmitters. And that's really the only, well, that and Vyleesi, it's so bremelanotide, right? Those are the two FDA approved drugs that we have here in the US. We don't have any other medications. And of course, we use testosterone off label
Often.
for libido in women. But to really, I mean, we don't have that much research, and definitely not as much research as we have for men. So,
That's
I
true. And also, if I can add, the issue is that everything which is related to the female sexuality and the medicines related to the female sexuality is apparently is always controversial. People is
yeah,
always discussing a lot.
yeah,
Nobody was discussing about the blue pill, so the blue pill is there, and there is not so much discussion. And the research is interesting, but not as interesting as it is into the controversial field, which is the female sexuality. The problem is that we must learn to separate what is really scientific and what is ideologically
yes,
related, because it seems that again the ideological and political perspective are impacting tremendously also into the choices of the regulatory agencies.
yep,
Because, for example, in Europe, we do not have the same drugs yet.
mm,
Something is ongoing, something is difficult. The testosterone for female, the patch of testosterone for female has been approved many years ago. But unfortunately, despite strong evidences into menopause, into the precocious menopause, and sometimes also in non-menopausal women, that patch died in Europe, let's say died because the gynecologists did not prescribe it at all. They
oh,
were, despite the evidences, very strong, published in the New England Journal of Medicine, so very strong, and cannot be better, actually. Nobody was really interested in. And this is another major cultural problem which I'm facing daily in my clinical practice. It is about the menopause, because many gynecologists are still believing that menopause means you have to stop any thinking about yourself as a sexual actor. And
a
this is
hundred percent.
simply ridiculous, but
Yeah,
tremendously frequent.
yeah.
Many cases, my patients are telling me, okay, doctor, my gynecologist told me I am in menopause, so this is the nature. There is nothing to do. You have to accept the situation. And this is absolutely ridiculous. But
Yes.
the reason is that unfortunately, the large majority of the doctors, at least here, are not educated in sexual medicine, not at
Yes.
all.
Yes.
And into the gynecology school, into the gynecology residency, they are completely not exposed to
Correct.
patients with a sexual dysfunction.
Yep.
So I'm now holding a petition to the European community in order to have as a mandatory into the specializations of gynecology, urology, endocrinology, psychiatric, and venereology or dermatology. These residencies, these five specializations to have a sexual medicine, because I think that you cannot deal with sexually transmitted diseases at all if you don't know anything about how to make babies. If
Yes.
you did not receive any formal lesson and exposure to the patients, how you can discuss with the patient about HIV, for example, or menopause, or andropause, or prostatic cancer, or hyperthyroidism, without knowing the effect that those things are having into the human sexuality, into the couple, into the relationship, and so on. But this is a matter of evidence.
Yeah.
We are doing a kind of survey, for example, in Europe regarding the schools of endocrinology, and we demonstrated that only a really small number of specialists in endocrinology have been exposed to lessons, to formal lessons, to education in sexual medicine and in psychosexology. Psychosexology, zero. Is just zero. But
Yep.
this is ridiculous because diabetes, for example, is a condition which is impacting into the
Absolutely.
psychology of people into a
Hmm.
dramatic way,
Yep.
both intrapsychically and relationally. So it is an hormonal disease, yes. It is a metabolic disease, yes. But it is tremendously related to the behavior because diabetes is coming from a lifestyle. So it is a kind of psychological disease. It is producing depression, it is producing anxiety, it's producing a lack of lubrication in female and orgasm, lack of erection in male. It is producing a reduction in steroid hormones, and in particular in testosterone. This is producing hyperactive sexual desire disorder. So, as you can see, starting from just a very, very popular, unfortunately, disease, which is diabetes, the major target for the endocrinologist, not knowing what is happening from a sexual perspective is simply ridiculous. It's absolutely a nonsense.
This is 100%. You need to come here and change the residency programs here. You are hitting the nail on the head. We do not teach sexual medicine in any of the residencies. I mean, not even gynecology. Nobody knows anything about female sexual dysfunction. How can we? I mean, I'm a gynecologist. How can I, as a physician, help a woman that comes to me for decreased libido, which is one of the most common reasons a woman comes, right, for sexual dysfunction is decreased libido. And 10% of those women, depending on what study you look at, but if the Preside study is a study you look at, that's 10% of women come in with distress due to their decreased libido. Then how can we help these women if we know nothing about them? And that's only in gynecology. We don't forget family medicine, forget any other kind of medicine, endocrinology, forget it. Internal medicine, nobody knows anything. The only residents that even know anything at all about sexual medicine are urologists here in the US.
Yeah.
Nobody else knows anything about sexual. Nobody knows anything about menopause. Nobody knows. I mean, we're not teaching these
That's
things.
true. That's true. But I have also to argue that also the urologists can ameliorate their own perspective because it is true that in the United States, many urologists they learn something about sexual medicine, let's say from a very mechanical perspective or very
Mm,
mechanicistic perspective, And well, in Italy and in Europe is even worse because they are simply ignorant. They don't know anything, nor from a systemic perspective, nor from a mechanicistic perspective. So they simply don't know. But it is true that the identification of the urologist as the doctor for sexual medicine is very common in the United States. It is fun a little bit because gynecology is, pardon me, urology is a typical surgical discipline.
Yeah.
And the surgery is not too much related to the sexuality. It could be, but not so frequently. And so it is interesting to understand why only the urologist have been interested in the past in the human sexuality. I'm trying to understand that this
You know why?
cultural point. Yeah, tell me.
Because it focuses on men,
Yeah, it is. You're right. It is focused on men.
right?
It is also true that some urologists may be not interested or able to make operations, so
Yeah.
they may say that it would be better to deal with something easier, apparently easier, but it's not easy at all. It's very difficult. I'm always teaching to my students that sexual medicine is a part of internal medicine, but it is the most difficult one because you must know everything about
Yes.
angiology, about nephrology, about neurology, psychiatric, urology, of course, endocrinology. So all the disciplines are more or less related to the sexual behavior because, basically, from a natural perspective, we are just carriers of gametes, of eggs and spermatozoa.
Yeah.
So, from just a very, very basic and very tremendously simple perspective, human life and the life in general is just matter of reproduction and sex.
Yeah.
And so, if this is true, this is the reason why it is always involving everything. We are making. I'm currently producing a book, textbook. The name is "The Canary on in the Coal Mine." You know the story of the canary who is dying in the coal mine before humans. And the
No.
purpose, the aim of the book is to demonstrate that sexual dysfunction are the canary in the coal mine for the very, very large majority of the non-communicable chronic diseases, which is the major reason for being sick and the major reason to die. So the 4 or 5 families of diseases, which are the cardiovascular one, the metabolic one, the oncological, and the respiratory. Now there is also the psychiatric or the depression is have been added. All those families of diseases are preceded by a sexual dysfunction. So the sexual
Mm.
dysfunction is usually coming first, maybe some years before, then the most severe, or apparently most severe, non-communicable chronic disease. So if we are really interested in facing the current epidemic, and in the United States, this is a real tragedy because the epidemiology of the NCDs, of the non-communicable chronic diseases, is tremendously huge and tremendously related to the lifestyle choices. Using the sexual life as the biomarker, the early biomarker, the canary in the coal mine, I think it is a very important new perspective. Also, and I just wanted to add this one, I'm sorry that I'm talking too much, but I
No,
think
it's fantastic.
it is very important to also to say that dealing with sexual health is motivating very much the patient. So, in other words, since everything which is related to the lifestyle is hard to be obtained, because for the doctor it's very easy. You better don't drink too much. You cannot go to the junk food more than one per month, let's say. or some you cannot smoke, and you have to move more. All those things are easy to say, not easy to follow. So we definitely need something which is motivating the patient. And the sexual health is probably the most able argument to motivate the patient, the subject, to change his lifestyle, which is the major reason for the diseases and for also for dying. We also wrote a funny article. The title was the um, anti-inflammatory couple. The reason why we named anti-inflammatory was because inflammation is actually the common pathogenetic mechanism of all the non-communicable chronic diseases. So all are generated by subclinical or chronic inflammation. But the same inflammation is on the basis of depression, which is, for example, very common in female, and of arousal disorder, and of erectile dysfunction, and of more likely also of orgasmic disorder too. So again, we can use, let's say, as a tool, the sexual health in order to explain to the couple, you can help your partner to change his lifestyle and use into a really motivational way. Because it is true that when my wife is drinking a lot of wine, I'm also happy to drink with her, which is good sometimes. But if we are doing daily the same wrong behavior, this may really affect the general health of the two members of the couple. And back to my personal experience, when I was in the United States, I was an heavy smoker of pipe. I was smoking my pipe from the beginning of the day until the end of the day. Then my wife decided to quit cigarettes. It has been many, many years ago, actually. And I said to myself, what can I do now? Can I smoke alone in the house? This is something wrong. So after a few months, I realized that it was impossible to continue to smoke. And probably my wife saved my life in this way. So this is the representation of what it means, the anti-inflammatory couple, the couple which can be tremendously important to reduce the effect of the inflammation, both in the non-communicable chronic diseases as well in sexual dysfunction.
Amazing. I love it. I can't wait to read your book. That Canary in the Coal Mine, that sounds fantastic and really ingenious. When you think about it, how sexual dysfunction oftentimes is the first thing that we note, before we see like, heart disease or before we see all these other things, right? And I think that that's so important. And I'm glad you're writing that book. And I can't wait for that book to be published so I can read it and then tell everyone else about it to read it. So that sounds fantastic.
Yeah, just I wanted to add, stay tuned because the book will be published in spring in a few months and will be open
Oh,
access.
oh,
So everybody can
exciting.
download it. And
Yeah.
so the first book will be on male sexual dysfunction and the role of the canary in the coal mine. But we are planning to do another one in female also. So let's see how it is received, the first book, and then we will go to the female, which is always more complex, but
Yeah.
also more amazing and more interesting too.
Well, yeah, I mean that's where you come in and you start talking to everyone, letting them know. So I think that's fantastic. I'll be sure to, once that comes out, please let us know. We'd be happy to share that on all of our social media to let people
Thank
know
you.
that your book is out. Because
Thank
I
you.
think it'll be fantastic and so needed. So, if you were to leave people listening and watching this podcast with few pearls, what would you say were the most important things that you talked about that you would want to leave somebody with?
Oh, well, again, I want just to leave this great occasion to be together, to discuss together with our motto, teaching and searching pleasure. And I also I would like just to add another word to this motto, which is learning pleasure, because we are making sex by nature using our body, but also by culture. Because, as you said, the most important organ we have is between our ears, and that this is absolutely true. But don't forget what is between our legs, because this is also important for sex. So we definitely need to integrate both perspectives and having a Unitarian perspective, which is that one of the system sexology.
All right. Well, thank you so much. And thank you so much for your time. I know you are super busy, so I really appreciate the time that you gave us. You were very generous with your time. So thank you so much. And I look forward to reading your book. So, well, we are done here, and it's been real and really intimate. And remember, this is not meant to be any type of medical advice. So if you have any questions about your health, please speak with your healthcare provider. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.